Hello everyone, welcome to this session. I'm Dr. M. Singh. This is section 2 that is part of a series designed to help you understand how and why insomnia happens, why it often doesn't go away on its own, and most importantly, how your own habits, behavior, environment, and conditioning or maladaptive behaviors may help keeping it going. Goal of these sessions is providing information because when you understand how insomnia works, you regain a sense of control. Insomnia follows a predictable pattern and predictable patterns can be changed. You may notice single or multiple factors or behaviors related to your sleeplessness if you have any. The three factors that lead to insomnia, also known as the Spielman or 3P model, was proposed in 1987. This explains how insomnia develops and becomes chronic through the interaction of three types of factors: the predisposing, the precipitating or trigger factors, and the perpetuating or ongoing factors. Predisposing factors can be further divided into three subcategories: the biological factors that include genetic predisposition, increased basal metabolic rate, hyperreactivity of the person, and differences in the neurotransmitter systems in the brain and the body. Psychological factors include tendencies towards worrying and ruminative thinking. Social factors include influences such as differing bed partner schedules, preoccupation with the daily jobs, and social pressures. The precipitating factors include life stresses and events such as some serious bereavement, medical or psychiatric illnesses, change in the job, or change in the house. When these stresses interact with existing predisposing factors, insomnia becomes expressed. The perpetuating factors are the behaviors, we may even call them as maladaptive behaviors, that are often adopted as attempts to compensate for the poor sleep, such as staying in bed while awake or spending excessive time in bed, or may even include a daytime napping. This image summarizes the three factors. On the left are the predisposing factors, the middle part shows the precipitating factors, and the right side shows the perpetuating factors. The image shown here is to emphasize that the predisposing factors in color red are already existing in an individual who has not insomnia at the stage. But when the precipitating factors shown in green, like acute stressful life events like bereavement, change in a job, it creates a factor that develops or even it helps in precipitating insomnia, crossing the threshold line of insomnia shown here. On the right, yellow color is shown to indicate the ongoing or perpetuating factors. These are some of the maladaptive behaviors that one may develop to compensate for insomnia, like spending extra time in bed while awake, or taking naps during the day, or even irregular sleep schedules. CBTI, which is cognitive behavioral therapy for insomnia, is directed at treating these precipitating and perpetuating factors. So, the key takeaway: insomnia isn't just about stress or genetics. While those may start the fire, maladaptive behaviors keep it burning. Even after your stress disappears, these habits maintain the cycle, turning a temporary struggle into a chronic condition. It is the persistence of habits that truly matters. Thank you for watching the video. Please like and subscribe. I would welcome your comments and suggestions.